This program is brought to you by Dr. Reddy's Lab. Hi friends, and welcome to another kidney program. We are in conversation with Dr. Dilip Kirpalani, and this is Bosco Rodriguez with you on the show. Doctor, I'm not going to waste any time because we've got very little time over here. The very first question I'm going to shoot out is, what are the options for a patient with end-stage kidney disease, and which is better?
So basically, once you tell a person that he's got end-stage kidney disease, what you're basically telling the patient is that your life is not possible further without an artificial support. So you need an artificial prolongation of life. And that prolongation is in the form of either dialysis or kidney transplant. These are the two options. Now, to make it simple, the kidneys are basically a washerman of your body. They wash your blood just like your washerman wash your clothes. So what do you do when your washerman becomes permanently sick or dies? You either employ a new washerman or you wash your clothes in a washing machine. Similarly, when the kidneys die or function less than 10%, that's end-stage kidney disease, you need to wash the blood by an artificial machine, a washing machine, that's called dialysis. Or the other option is kidney transplant, wherein you employ a new washerman. That means you put a new kidney in the body. As far as which is better, clearly in a young to middle-aged person, in fact even up to the age of 65 years, if somebody is diagnosed with end-stage kidney disease, transplant is clearly the better option. There's absolutely no doubt about that. I'll explain this to you in simple words. If you have a 50-year-old man, for instance, and he's diagnosed with end-stage kidney disease, if he chooses to be only on dialysis, you can extend his life by an average of 5 to 8 years. That's it. No more. On the other hand, the same person, if he goes for a kidney transplant, then depending on various factors, he could get new life from that new kidney for anywhere between 5 to 10 years or even longer. Then once that kidney fails, he still has the option of going back on dialysis for a couple of years. And what's better is that he has an option of a second transplant, or what is a retransplant.
Right.
That could give him life for another 5 to 8 years.
Yeah, right, exactly.
So clearly the prolongation achieved of life with kidney transplant is much more than what you would get with just dialysis alone. More importantly, the quality of life after the first few months of a kidney transplant is like an absolutely normal person after a kidney transplant. And this is not the case with somebody who continues on dialysis. His quality of life is compromised to a certain extent compared to somebody who's had a kidney transplant.
Right. Okay, doctor, before we ask you the next question, we probably will take a break. We'll be back.
Have a holly jolly Christmas. It's the best time of the year. Now I don't know if there'll be snow, but have a cup of cheer. Have a holly jolly Christmas, and when you walk down the street, say hello to friends you know and everyone you meet. Oh, the mistletoe is hung where you can see. Somebody waits for you. Kiss her once for me. Have a holly jolly Christmas. And in case you didn't hear, oh by golly, have a holly jolly Christmas this year.
Hi friends, and welcome back to our Kidney Health series. This time we're in conversation with Dr. Dilip Kirpalani, and this is Bosco Rodriguez with you on the show. Doctor, my second question is, what exactly is done during a kidney transplant?
So the kidney transplant surgery is basically performed on both the donor and the recipient. And the donor is the person giving the kidney, the recipient is the patient, the person who's receiving the kidney. And both the surgeries are done simultaneously in operation theatres which are very close or neighboring to each other. Both the surgeries are done under general anesthesia. Now, once the kidney is removed from the donor, it is washed with certain sterile fluids and almost immediately put into the abdominal cavity. That means the lower part of the abdominal cavity, usually on the right side in the recipient. And this is in medical terms called the right iliac fossa. Most of the time, the original kidneys of the patient are not removed. They are left where they originally belong, in the flanks of the patient. Now, once the kidney transplant surgery is over, the patient needs to be moved to an isolated room, like for about at least 7 to 10 days. Now, why is this? This is because to make the new kidney work, we need to give very powerful medicines to the patient, and these are called immunosuppressive medications. And what do immunosuppressive medications do? As the name suggests, they suppress your immunity. Why do we need to suppress the immunity? Because we need to allow that kidney to function in the patient's body. So the patient's body will try to reject that new kidney, which will act like a foreign body. So to make the patient tolerate or accept that new foreign body, we need to suppress the immunity. But you must remember that when we suppress the immunity, we also leave the patient vulnerable to various infections because we are suppressing his immune system. So the doctor and the visiting nurse visiting him must wear a sterile gown, cap, mask, and sterile slippers or shoe covers when they go near him. This is called barrier nursing care in medical terms. And blood tests are carried out daily for the first few days on the patient to check the blood counts and the kidney function, what we call the blood test called the serum creatinine. And sometimes, often they are done twice a day. And we as a visiting nephrologist I would like to see my patient in the first 7 days after the transplant a minimum of 2 to 3 times daily, and I'd like to keep a watch on his blood pressure, vital parameters. The urine output is monitored every hourly in such a person, because if we don't do this, this is the most vulnerable phase, and the first 1 week is the most vulnerable time when the patient is not only prone to reject his kidney but also maximally prone to infection. So that first 1 week is absolutely crucial.
Okay, doctor, thank you so much. And our final question is, what are the medications required and the restrictions for the donor?
See, the donor needs absolutely no medications after a kidney transplant. The kidney transplant surgery is a very safe surgery provided the donor has been correctly selected. The lifespan of the donor after kidney transplant is as much as that of a normal person. The only real restriction on the donor for the first 2 to 3 months after a kidney transplant surgery is that he should avoid lifting heavy weights and avoid any heavy exertional activity, because there may be a big scar there, and there's a risk of that scar opening up.
Exactly.
Yeah, if that's what we call as a hernia in medical terms. Aside of that, he has to remember that now he's left with only one kidney, and he can live absolutely a normal life with that, provided he takes 1 or 2 precautions, like avoiding unsafe medications for the kidney, such as painkillers like non-steroidal anti-inflammatory drug. And for the first 1 year, every 3 months, he needs a health checkup with his BP, blood and urine checked up. And after that, for the rest of his life, once a year, he needs to be checked up. That's all. So my message is here that don't worry about donating your kidney to your relatives. It's an absolutely safe surgery, and it's very satisfying to oneself.
Thank you very much, doctor. You were listening to Dr. Dilip Kirpalani, a famous nephrologist in the South Bombay Hospital. This is Bhaskar Rodriguez with you on the show. We're going to be back again next time on the 13th of March 2014. We're going to take this topic forward and concentrate on kidney transplant and who can actually be a donor. You want to send in your emails, you can write to us on dilip_kirpalani@yahoo.com. Till we meet again next time, take care. This program was brought to you by Dr. Reddy's Lab.